well. Let's see how we're doing. Ooh, yeah. Ooh, yeah. Okay, so Mr. Cyberthrone. It's like an intimidating name. Mr. Cyberthrone, any advice on how to get rid of red cheeks, neither retinoids or SPF 50? They don't help, basically, is what they're saying. So red cheeks, what's causing the redness is going to be either inflammation or vessels. Again, anytime you're talking about vessels, especially if red cheeks is usually probably going to be caused by that vessel type of rosacea, things like metronidazole gel have been shown to maybe decrease that progression of the redness, but very little topicals are actually going to help treat it. Like things to soothe, like Centella asiatica, can help decrease inflammation if there's that component. But unfortunately, if it's at all vasculature that's already dilated, vessels that are already dilated, topicals are just so disappointing. So disappointing. But if it's inflammation, that's a whole other thing. I mean, we have a whole list of things that can be like red cheeks. I mean, so I guess that's kind of the crux of being a physician sometimes is you're like, oh yeah, probably erythrometatophalangic categorization. I haven't seen it. I'm not sure. But in the back of my mind, I'm like, okay, well, what else can cause it? Acute systemic lupus, like it causes like red cheeks and a butterfly distribution. I mean, rosacea obviously causes it in the same distribution. Any type of photosensitive condition can be triggered by medications, can be triggered by other things. That could all cause red cheeks. There's just like a whole laundry list of things. So this is like the utility of a doctor, I guess, sometimes. So if you see a doctor, you see a dermatologist specifically for something like that, they can confirm what it is you're going after and then hopefully give you like a very limited and isolated list of things that can specifically target it. Because that's sometimes like communicating to your doctor is really important. Like be very forward about your goals with your doctor about how much something bothers you, because sometimes we see 100 patients a day with red cheeks. And unless you identify and let us know, like, this is very important to me, we may not know that we needed to hone in and focus there because we see it so often and just don't like focus in and narrow in on it. So